All right, in this video we will be discussing about fatigue. Fatigue is another topic in the continuity of symptomatology of neurology. Right, we are discussing this topic under neurology. It is a symptom of neurological disorders. Fatigue is one of the most common symptoms in clinical medicine. Yes, many patients come to the OPD with main complaint of fatigue. Fatigue refers to the subjective experience of physical and mental weariness, sluggishness, low energy and exhaustion. Right, it is a very vague kind of symptom. Means the patient feels low energy, the patient feels exhaustion, the patient feels sluggishness and mental weariness, mental and physical weariness. Right, so these are the things that we have to remember. In the context of clinical medicine, fatigue is most practically defined as difficulty initiating or maintaining voluntary mental or physical activity. Right, the patient is not able to either start or maintain the activity. Fatigue should be distinguished from muscle weakness. Very important. What else do we have to do? Right, we have the main problem of distinguishing fatigue from weakness, because weakness is actual decrease in the power of the muscle, but fatigue is a subjective experience. Right, weakness is a sign, weakness is demonstrable, and we have proper grading for weakness, but fatigue is a symptom, it is told by the patient only. So we have to differentiate fatigue from muscle weakness. Right, muscle weakness is a reduction of neuromuscular power. Then fatigue is also distinct from somnolence. Right, firstly we have to distinguish from muscle weakness, secondly from somnolence. Somnolence is basically increased sleepiness which occurs during daytime if the patient has not taken proper sleep in the night. Means disturbed sleep wake physiology will lead to daytime somnolence. So fatigue needs to be distinguished from somnolence, because somnolence will be corrected once you restore the sleep wake physiology, but fatigue is something else. It is related to many underlying conditions. Right, it can be related to some psychiatric illness, neurological illness, cardiopulmonary illness, endocrine illness, right, nutrition. So there are many causes of fatigue that we will be discussing in the upcoming slides, but somnolence is something else. So we have to differentiate. Basically, first of all, we have to make sure that this is fatigue, this is not muscle weakness or somnolence. Or what else can it be there? Muscle weakness, somnolence. Right, all right, now we come to the differential diagnosis of fatigue. Means what causes fatigue, what are the causes of different causes of fatigue. Right, first is a psychiatric disease. Fatigue is a common somatic manifestation of many major psychiatric syndromes including depression, yes, anxiety, somatoform disorders. Yes, psychiatric symptoms are reported in more than three-quarters of patients with fatigue. Right, so fatigue is something different from psychiatric illness, but fatigue is present in psychiatric illness. Then neurological disease. Patients complaining of fatigue often say they feel weak, but upon careful examination, weakness is not there. Right, weakness is not found, but the patients feel weak. Means this is not weakness, but this is fatigue. Now we have to differentiate between fatigue and fatigability. These two are very different terms, and it is asked in one of the entrance exams in previous years. Right, fatigability versus fatigue. Fatigability means if you repeatedly use a certain muscle, if you repeatedly contract a certain muscle, the consequent contractions will have low power. Means the muscles ability to contract with the same power is not there. Right, Fatigability means with subsequent contractions, the muscle power will be reduced, and it is characteristically found in myasthenia gravis. But fatigue uh, is something in which fatigability is not there, right? The patient is able to maintain the power of contractions over a repeated and number of times of contractions, but fatigability means there will be a decrease in the power. So fatigability is found in myasthenia gravis, but fatigue is something else. Now, sleep disorders also need to be differentiated from fatigue. Obstructive sleep apnea is a cause of daytime sleepiness. It can cause fatigue, right? Then endocrine disorders, hyperthyroidism, adrenal insufficiency, hypercalcemia, right? Hypoglycemia, and low vitamin D, very important. All these are causes of weakness, and they can present with fatigue, right? Hypothyroid, hyperthyroid, adrenal insufficiency, hypercalcemia, hypoglycemia, low vitamin D status. It is very important. Nowadays, it is very common that if a patient is having low vitamin D, he will complain of fatigue. All right. Now, liver and kidney disease. Many patients on hemodialysis present with fatigue. CLD present with fatigue, right? Obesity is also a cause. Physical inactivity is also a cause of fatigue and weakness. Malnutrition and infection can be there. Many drugs, you have to remember the drugs, right? Which drugs? Antidepressants, antipsychotics, beta blockers, anti-seizure agents, antispasticity agents, opiates, and anxiolytics. All these drugs can cause fatigue. Then cardiovascular pulmonary problems like heart failure, pulmonary hypertension, interstitial lung disease, COPD, pneumonia, infections. All these cardiopulmonary causes can cause fatigue. Malignancy. Many a times patient with malignancy presents with fatigue itself. Why? Because of interleukins. Interleukins are what? Uh, Interleukins are inflammatory markers which are released in carcinomas. So they are responsible for fatigue in these patients. Hematological disorders like anemia will present with fatigue. Immune mediated disorders like RA, SLE, pregnancy can cause fatigue. Disorders of unclear cause like myalgic encephalomyelitis or chronic fatigue syndrome, fibromyalgia, multisystem illness like Gulf War syndrome is another symptom complex with prominent fatigue. So these are all the causes of fatigue. Let us revise them once again. Uh, in DD, we have psychiatric disease like depression, anxiety, and somatoform disorders, neurological disease like myasthenia gravis, right, and many others. Even stroke can present with fatigue. Sleep disorders like obstructive sleep apnea, endocrine disorders, hyperthyroid, adrenal insufficiency, hypoglycemia, and low vitamin D. Liver and kidney disease, both CLD and CKD can cause fatigue. Many patients with hemodialysis, up to 80%, more than 80% patients with hemodialysis can complain of fatigue, right? Malnutrition, physical inactivity, infection, obesity can all cause fatigue. Then drugs, you have to remember the drugs by heart: antidepressants, antipsychotics, beta blockers, anti-seizure, antispastic, opiates, anxiolytics. Cardiovascular disorders, malignancy, hematological disorders like anemia, right? Immune mediated disorders like RA, SLE, pregnancy, right? Unclear cause like chronic fatigue syndrome, myalgic encephalomyelitis, fibromyalgia, right? Chronic multisystem illness, they all can cause fatigue. Now, how do you approach the patient with fatigue? Obviously, you will take history first of all, and then you will examine the patient. In history, where we have to understand whether it is acute or chronic, whether it is primarily mental, physical, or a combination of the two. The review of systems should be attempted to distinguish fatigue from sleepiness, dyspnea, exercise intolerance, and muscle weakness. Very simple. We have to differentiate. Fever, chills, night sweats can point to malignancy or infection. We have to, review the drugs. Social history, sleep habits are important, right? After that, sometimes fatigable weakness can be present, and it is present in myasthenia gravis. Fatigable weakness means myasthenia gravis, neuromuscular. General physical examination should screen for signs of cardiopulmonary disease. Right, we have to do general physical examination to rule out cardiopulmonary disease, lymphadenopathy, organomegaly, malignancy, liver, kidney disease, malnutrition, etc. Right. What investigations can you do? Though investigations will not be very much helpful, but yes, you have to screen, you have to do the routine investigations like CBC, right? Electrolytes, glucose, liver function, thyroid function, renal function. Testing for HIV and adrenal function can also be considered, right? Now, this slide will show us about the treatment. What treatment options do you have? We have antidepressants, we have cognitive behavior therapy, we have psychostimulants like amphetamines, modafinil. They can increase alertness in daytime sleepiness. Vitamin D, very important. We have to supplement the patient with vitamin D if it is deficient. Now, cytokine antagonists are basically a topic of research. These drugs are not right now prescribed for the treatment of fatigue, but they are under research studies whether they can be used in fatigue or not, right? So this is the treatment options: antidepressants, CBT, psychostimulants, vitamin D, and some future prospects. Prognosis. uh, Acute fatigue significant enough to require medical evaluation is more likely to lead to an identifiable cause, right? Evaluation leads to diagnosis of a psychiatric conditions many a times. Now, it is very important to know that complete resolution is not very common. It is uncommon. But multidisciplinary treatment approaches can lead to symptomatic improvements that substantially improve quality of life. Right? So, this is all about the fatigue. Right? We have to, uh, first of all, we must know what is the definition of fatigue. Fatigue is a symptom told by the patient. Then we have to differentiate it from fatigability, and then we must know the all the diseases of other organ systems which can present as fatigue, right? After that, we have to examine the patient, then we have to treat the patient, and we should know the prognosis of the patient so that we can counsel the patient very well, right? So that is all about fatigue. It is a very new kind of topic, but yes, it is definitely important, and you will learn something about fatigue if you know take it more seriously, right? So that is all about this fatigue. Thank you so much for your patient listening. Yes.